All right, Esther, do you want to get us started?
Sure. So good morning, everyone, and welcome. This is our first Focus Cities webinar of 2018. My name is Esther Postiglione, and I'm your moderator today. I am the State Policy Manager with California Walks. We are the statewide voice for pedestrian safety and healthy walkable communities for people of all ages and abilities. We provide technical assistance throughout the state on active transportation, as well as lead some state policy work. We are partners with UC Berkeley SafeTREC for our Focus Cities efforts. For those not familiar, SafeTREC stands for Safe Transportation Research and Education Center. They are a University of California, Berkeley Research Center affiliated with the Institute of Transportation Studies and the School of Public Health. Their mission is to reduce transportation-related injuries and fatalities through research, education, outreach, and community service. SafeTREC conducts research, provides technical assistance and workshops to communities across California, educates the transportation safety professionals of tomorrow, and coordinates major transportation safety programs for the state of California. We'd also like to acknowledge the support of the California Office of Traffic Safety, who provided a grant through the National Highway Traffic Safety Administration for this program. We appreciate their dedicated support of community pedestrian and bicycle safety. Before we dive in, a couple of reminders. Please be sure to mute your audio, and also know that we will be recording both the webinar's audio and chat features, and we will make the recording available afterwards. If you do not want to be recorded, please refrain from talking or using the chat feature. If you have questions throughout the webinar, please type them in the chat box on your screen, and we will take them at the end of the presentation. I will be reading those aloud to Brandie at the end, so we will have plenty of time for questions. And so now we're going to go ahead and transition over. So I'm really excited to introduce today's presenter, Brandie Banks-Bey. Brandie is a program manager at Cultiva La Salud. Cultiva La Salud is dedicated to creating health equity in the San Joaquin Valley by fostering changes in communities that support healthy eating and active living. Brandie has been with Cultiva for over 10 years and currently manages the CDC Racial Ethnic Approaches to Community Health, or REACH project. This project has received nationwide recognition, including a piece in the New York Times. Brandie has her bachelor's in mass communications from California State University, Fresno, and has been an integral part of Cultiva's success. She's going to talk a little more with us today about the importance of community engagement and the successes they've seen in the San Joaquin Valley. So without further ado, Brandie, go ahead and take it away.
Good morning. Thank you, Esther. So I just want to start by saying, we really do appreciate the partnership with California Walks and the opportunity today to talk about the work that Cultiva La Salud has done in Fresno, and specifically around engaging residents in local policies that support pedestrian and bicycle safety. And so I know Esther touched on this a little bit. My name is Brandie Banks-Bey. I'm a program manager with Cultiva La Salud, and just a little bit of history. We were formerly known as the Central California Regional Obesity Prevention Program, and we've been around for over 10 years, so actually 12 years as of this year. And one of our missions, or sort of our motto, I should say, is that we really believe that everyone should be able to live the full course of their life in optimal health, and that's really what drives a lot of the work that we're doing. Cultiva La Salud is a community-based initiative working in the Central Valley, and as Esther said, we're working to help improve health equity. And I think much of our work is really closely with the residents, who are central to a lot of our efforts, and our interventions are aimed at improving access to healthy foods, promoting physical activity for Latinos living in disadvantaged communities. What's really central, though, to this process is just residents are educated about and can inform those local policies that support healthy eating and active living. And so just really quick, about 4 years ago, we were funded by the U.S. Department of Health and Human Services under their Racial and Ethnic Approaches to Community Health initiative. And so under that project, we targeted 6 predominantly Latino neighborhoods and communities in Fresno, Stanislaus, and Kern counties. Currently, during this last year, focusing our efforts in Fresno County, and that's specifically in Southeast Fresno and in Orange Cove. The aim of REACH is really around increasing access to healthy food and beverage options, as well as opportunities for physical activity among Latino residents. And so in many of the neighborhoods we're working in, residents lack access to healthy foods. They're surrounded by unhealthy foods in many cases. One of the ways that we've helped to address some of these challenges is, partnering with schools, local farmer to set up school farm stands. That really allows the residents to purchase fresh fruits and vegetables for an affordable price. Just real briefly, we work to address the consumption of unhealthy foods as well, and disincentivizing unhealthy foods. And locally, we're working on a local ordinance called Healthy by Default. We're partnering with public health advocates, and the work that we're doing is really around trying to establish a law that would ensure that restaurants who serve kids' meals will only offer healthy beverages such as water and low fat as a healthy default option. And so just kind of turning to more of the work around physical activity, we've worked again in neighborhoods where residents are lacking safe places to be physically active. And so some examples of the work that we've done under physical activity is really engaging residents around the need for safe places to play, which has led locally to a partnership with school districts and the cities and joint use policies that support residents' access to school space for physical activity. And so leading to the last priority, which is really around walking and biking, our work is really centered around engaging and educating residents about bike and pedestrian safety and connecting them back to local policy opportunities that they can help to inform and help to shape. So that's where most of the webinar is going to really focus on, is with the engagement of the residents here in Southeast Fresno around those local policies that support pedestrian and bicycle safety. And so just making sort of more of a direct connection, I wanted to point out that our role and our commitment here with, at Cultiva La Salud is to help support walking and biking policies and strategies as a way to promote health and prevent chronic disease. Our work really in involving residents to inform these policies helps to better inform city leaders about the challenges that Latino residents face, and also helps to lift up those solutions, which are critical. And so just really getting into more of the key objectives of the webinar, we're hoping to just underscore many of those challenges that residents have shared in terms of walking and biking in Southeast Fresno. Some of the creative and strategic approaches that we've utilized to engage residents around walking and biking in Southeast Fresno, community engagement efforts around the active transportation plan, how that led to more equitable policies or projects, and then lastly around infrastructure improvements that we're starting to see in Southeast Fresno. And so just a little more about Southeast Fresno. So Southeast Fresno is a community that's very diverse. The Latino population represents over 70% of the overall population. In that community, over a third of the population are also under the age of 18, and over half of the residents are living in poverty. When you begin to look at the health status of this community, residents struggle with obesity, with diabetes, other chronic related diseases, and so nearly 40% of residents in that community are obese, compared to about 25, almost 26% statewide. South Fresno, so this is Southwest and Southeast Fresno, has an average of about 1.02 acres of park space per 1,000 residents, and that's in comparison with the north part of Fresno, which the average is more like 4.62 acres per 1,000 residents. So there's definitely a inequitable balance there. And due to the limited investments in parks, walking paths, bike lanes, other modes of active transportation, residents in Southeast Fresno have limited opportunities to engage in physical activities such as walking, biking, and all of that is critical to their health and their well-being. And so just to talk a little more about the walking and biking challenges, in this particular community, many residents have, they do rely on walking and biking to school, to work, for physical activity, but it is really unsafe, and communities lack adequate supports and resources. They're in need of new sidewalks, sidewalk maintenance. There's a lack of walking paths in that community, lack of bike lanes, or what you would also call complete streets with, the sidewalks, the full bike lanes. they're lacking in that community adequate traffic calming measures, especially in school neighborhoods. And sort of the last two challenges have really more recently popped up, but lighting is a challenge. So in that school neighborhood in particular, multiple school neighborhoods, I should say, lighting, especially as it gets closer to children walking to and from school at the later hours, is really a challenge. And then loose dogs has been a challenge for quite some years, and it really does prevent residents from walking and biking. And just to share a little more about that, there really is a disparity in access to physical activity, and it is evident because the majority of the multi-purpose trails, bike lane networks are located in North Fresno. In addition to limited infrastructure that's in Southeast Fresno, there's high rates of bicycle and pedestrian collisions. A majority of the hospital visits due to pedestrian and bicycle collisions are really located in Southeast Fresno. So that just speaks to, again, the disparities in access to physical activity and just kind of making that corresponding relation back to poor health status. Okay, so these are just some images, some of the concerns we're seeing. We actually, at Cultiva, we've captured quite a few of images as we've seen, residents, again, trying to engage in physical activity, namely walking and biking. And so there's been, dogs in the community that make it unsafe for residents to go out and walk and bike. There's been dogs that have come up on some of the school campuses. The parents are leaving to walk home with their children. So this has been a big problem. There's a number of high traffic areas. This is just in one of the school communities, but this is an area where it's a one-way street, and it's very congested, especially at the time where everyone is dropping off their children or picking them up. The lanes are narrow, and again, just really congested with the cars, and going back to just the challenges to walking and biking there. This really speaks to some of the inequities, the infrastructure inequities. And so just really potholes, and I'll go to another picture that I think spells that out a little more clearly, but just poor pavement conditions, not being able to read the signage, faded pavement markings. Those have all been challenges for, and unsafe also for residents to be able to walk and bike in their neighborhood. And so this is just a picture of some of the potholes. And then you have water, that's also in the area where a lot of residents or children are crossing to get to school. And so we've, over the course of the last 4 years, Cultiva La Salud has been engaging residents in a very culturally specific way to ensure that they have a place at the table, but it, really just around informing the improvements to walking and biking that need to take place in their community, but also being a part of that process of solutions. And so this is just one example that we've been engaging residents, and they're called Cumbia Rides. So they're group bike rides. They're very fun and culturally relevant, especially within the Latino community. And so this is an image of one of them that took place, and it is a combination. You'll see youth and the adult residents out there. But we typically leave from a school neighborhood called Banks-Bey Elementary, and we go through a phase of where we do teach bike safety education at the very beginning of every single ride. We make sure that minor bike repairs are made, like filling up tires, fixing anything to make sure that residents are safe on the ride. But cumbia, the name of that goes back to the music that's played on the ride. So it is cumbia music, and it's fun, and again, it is culturally relevant. And so, on the ride, the residents are also taking note of just on their actual travel, what it is that sticks out to them as just a concern that needs to be fixed. Really trying to be a part of the conversation also about what other supports or resources need to be in place for it to be more of a bikeable community there. And so just real quickly, some of the other activities that we've engaged in, and this is in partnership with a group called Fresno County Bicycle Coalition, has been around bike kitchens and bike rodeos. And so the bike kitchens is an opportunity. It's a free event, but residents are coming out and getting their bikes fixed at that event. So again, these are minor repairs, but it does promote more residents out there on the road, biking. And so this is another critical way of engaging residents as they're out there, and just making sure that they also have the bike safety skills. And so one of the other images with more so the youth is a bike rodeo. And so that really speaks to going through more of a bike safety education course, and even an obstacle course at that, where youth are learning the proper hand signals. They're really learning about just the appropriate ways of riding on the road. And so this, again, makes sure that they're safe, but it's another really key opportunity to engage them. And so on the other side of biking, we have been engaging a lot of residents around walking as well. And so a few years ago, we worked with a student intern, and she helped in engaging residents and in really just trying to meet the need of what it is that they wanted to see around physical activity. And so one of the things that popped up was developing or establishing a walking group with the moms that were in the Winchell school neighborhood. And so she started up that walking group with the ladies. It's over time, it's grown, and I think now we have about 12 ladies who are participating in the walking group. But I think what's really unique about that is that the residents not only get their regular physical activity, it happens typically on Tuesday mornings every week, but they've built a stronger sort of social network through that activity. And on top of it, they've learned the skills, or strengthened, I should say, their skills around leadership. And so they've become more vocal over time. They've learned more about policy systems, environmental change. They've also learned about different opportunities from Cultiva about how they might be able to weigh in on a particular policy or a plan. And so that's really been a key group, and really strong. And like I said, it's been growing over time. And so with the walking group, or that model in particular, has really led to interactions also with some of the local elected officials. And so we call them walk and talks, but this has been an opportunity where the residents have been able to go out, invite an elected official. In this case, it was one of the school board trustee members here locally, and talk about what it is that they're seeing, the concerns that they might have in the neighborhood there that's making it difficult for them to be able to walk, and then really continue to have those conversations about what can be done collectively around those improvements. And this has happened with at least a few of the elected officials, and there's been multiple meetings that have taken place. But this helps because it does give them sort of that hands-on experience of what it is to be in the shoes of the moms who are walking with their children every day, seeing these challenges, and can just get a visual of what, again, needs to be changed in that community. And so here's another picture. And this is with our city council member, Luis Chavez. And so sort of lastly, in regards to some of the examples of how we've been engaging residents, we did hold a few different walk to school events around really. And so those were really well attended. We had an opportunity to engage the youth on different routes leading up to the school, and really helping to promote the importance of walking, how it gets students, not only do they get the physical activity on a regular basis, but it gets them prepared to learn. And so there's multiple benefits. And I think in addition to that, we've held debrief sessions after those events with parents, youth if we can as well, that really speak to their experience on the walk with the youth, but also just what else is going to make it conducive to them being able to do that on a regular basis. And so I think this has sparked ideas or priorities around like walking school buses, crossing guards, and a number of other supports. So that's been really effective. This girl is adorable, and so we had to showcase that, but this was on one of the walk to schools, and she was happy, and as you can see, the youth were really having a good time. And so kind of wanted to transition a little more about how, again, some of these activities like rides, the walking groups, the walk to school days, how that all leads into these larger policy efforts. And so one of the major areas that Cultiva was involved in over the past, say, almost 2 years probably, was engaging residents around the active transportation plan here locally. And so the active transportation plan is a long-term sort of detailed plan or outline of the city's transportation system. The plan focuses primarily on expanding the access to services, developing and improving, and as well as maintaining the roadways, the transit system, and active transportation infrastructure. So for example, walking and biking. And so in 2016, this was really a timely opportunity for Southeast Fresno residents to address those inequities in their community and to prioritize the projects that promote physical activity and healthy lifestyles. And so Cultiva La Salud, along with Leadership Council for Justice and Accountability, played a leading role in engaging Southeast Fresno residents around the ATP. And we were both instrumental in holding educational meetings with elected officials to discuss challenges and then potential solutions for the plan. And so this is a picture at one of the community workshops here locally. You know, again, just making that connection back to some of those activities, which were really helpful. The resident-led activities such as the bike rides, the bike safety clinics like the bike kitchens or the bike rodeos, alley cleanup days as well. That all led back to sort of the initial phases of advancing opportunities for active transportation in Southeast Fresno. And then at these community workshops, you know, residents identified clear disparities. So Cultiva and Leadership Council presented opportunities for the draft plan based on that information. And again, it was really centered around trying to address equity, trying to address gaps in existing infrastructure, and coming up with policy language that really did prioritize neighborhoods of most need. And Southeast Fresno is definitely one of those. So one of the most important things to lift up about that process of resident engagement and also just in the policy aspect of it was that there was an equity tool, and I believe it's also called a prioritization tool here locally that was adopted as part of the plan. And so the equity tool did help to establish a fair scoring process, and it was based on the following criteria. So it was access and equity, connectivity, traffic control, mode shift, and user comfort. And so we do have, by the way, we'll be sharing a resource at the end of the, or after the webinar with all of you who are interested, but one of the resources is the actual equity tool itself. And I just wanted to share that that was developed in the city of Rancho Cucamonga, and the city staff had adapted that rubric for it to fit the needs of Fresno here. And so this was, but the equity tool, just to say that that was really championed by local advocates. So that was residents, by Cultiva, Leadership Council, and other advocacy organizations who really wanted to see more improvements, especially in those disadvantaged neighborhoods. And so the tool was adopted and embedded throughout the plan. And so you'll see that we'll send a link to the active transportation plan, and it is really long, but you will see the pieces of that equity tool embedded in the actual plan. Just sort of additional information on the equity tool. So leading issues that were highlighted as part of that were safe routes to schools, areas surrounding schools, high density pedestrian and bicycle traffic areas, and then those communities that were historically disadvantaged neighborhoods. And so I wanted to just talk, we spent, again, a lot of time in engaging residents around that process with the active transportation plan and just with any other opportunities along the way that came up around just helping to improve biking and walking in Southeast Fresno. And so just to say, you know, not only was the active transportation plan and the adoption of a new equity tool a win, and meetings with elected officials, Cultiva has begun to see incremental improvements in walking and biking infrastructure in Southeast Fresno. And so I did want to share some of that back. So there was a previous image, and I can go back to that if I need to, but of just some challenges in the markings of the walkway here, and where you see the little kid, and I think I want to say it might be an older brother or dad with him, but the signage was in disrepair. And so this is an update, just more of a recent update of just some of the really make a difference. And so this is, sorry. This is proper, excuse me, this is updated signage as well to make it safe for residents, for students to cross. This is actually on Butler here in Fresno, where new bike lanes were put in. And so we were so pleased that day. We actually were able, excuse me, to see one of the bicyclists as we were out there trying to capture some of these changes. And again, new signage, especially by the school neighborhoods, that really does speak to that it being a crosswalk, you know, slow down. And this again is helping to improve walking and biking in those neighborhoods. And so I did just want to, you know, sort of maybe lastly express, you know, none of this work could have been possible without the commitment of residents, you know, really, you know, their voices. And it also helped to have strong partnerships with local community-based organizations who really understand health equity and champions around bike and pedestrian safety at the city level. We have a long way to go, but these small improvements that we're starting to see help to really create greater opportunities for residents to lead healthier, longer lives. And so I kind of just want to turn it back to you, Esther, for any questions.
Great. Thanks, Brandie.
You're welcome.
So we do have, sorry, I was having issues with the unmute button, but thank you so much, Brandie, for that really great presentation. And I want to remind everyone at this time to please type any questions that you may have into the chat box. We do have one question that's up. And this is from, and I apologize in advance if I mispronounce any names, but this is from Natasha Upfell. Did you ever get pushback from the community that active transportation investment, such as bike lanes and wider sidewalks, were perceived as gentrification? And also, how did you address personal safety concerns around walkability?
Yeah, I don't think that that was the case here in Southeast Fresno specifically, but possibly in other areas like Southwest Fresno, where that has been definitely more of a conversation due to multiple efforts that are going on.
Thanks, Brandie. And I know, and Natasha, to respond a little bit to that question as well, I know that California Walks and SafeTREC hosted a community pedestrian and bicycle safety training workshop in Southwest Fresno last year. And that was something that came up in terms of not particularly in relation to gentrification, but a concern that bike lanes were not what the community wanted. And I think that's one of the reasons it's so important to engage community, is to make sure that investments that are being made and projects coming in are actually getting at the heart of community concerns, which is why community engagement is so important when we're talking about active transportation, when we're talking about just general investments to community, because it's really important to have them at the table and have their support, and also have them be the driving force like what Cultiva has done. I think another question, Brandie, that would be great is, what are some ways that partners that are on the phone, or maybe partners that'll listen to this recording in the future, what are some sort of best practices or things to consider when engaging with community and making sure that they're included and involved in the process?
Mm-hmm. Yeah, thank you, Esther. I think, you know, one of the ways that Cultiva was really effective at community engagement was that, you know, we really did try to make sure that when we were doing activities to attract residents, to meet them, you know, in their communities where they're at, it really was, again, culturally specific. So the Cumbia Rides were sort of this new but fun and, again, culturally specific way of engaging them. we've had the opportunity as well of, and this is just, part of Cultiva's history, we developed a curriculum, a leadership curriculum called Powerful People, creating healthier communities or building healthy communities. And that curriculum, we were able to take out to some of the residents and, train them around particular areas that built the foundation of, just sort of stronger leadership engagement, leadership development. And so that was a really effective tool in helping to build the leadership, helping to connect the dots back around why policy systems, environmental change is so important when we talk about, health and the health of communities. So I'd have to say that those two are probably, really effective tools that we've used, and which is, I think, speaks to, some of the results and the engagement that we've had.
Thanks, Brandie. And I think, right at the end, you touched a little bit on other partnerships with community-based organizations. Can you talk a little bit more about some of those partnerships and sort of why they were key and how you've been able to work with other groups?
Yeah, I think, and I might have mentioned them earlier in the presentation, but Fresno County Bicycle Coalition was key in partnering with us around the bike kitchens, the bike rodeo events. We partner with them still on a number of bike education opportunities, and that really is critical. It's a critical piece of moving, again, policy systems, environmental change, but building more awareness around just how to ride, again, safely on the road. And so that's been effective. But here locally, there is a group, Bicycle Pedestrian Advisory Committee, which is a really unique group in the sense that there is appointed positions. There are city folks who sit on that committee and talk about, we meet monthly, but we do talk about the active transportation plan, local infrastructure improvements that are needed around walking and biking, and these sort of challenge areas in school neighborhoods as well. And so collectively, the group has been, meeting, strategizing around how to address all of these needs. And so that's been, I think, very key in terms of Cultiva being at the table, residents as well, lifting up against some of these concerns or some of these challenges that have maybe been left behind. So.
Great, and we have another question here in the queue, and this is from Amelia Crotty, and she's asking leadership development. Brandie, can you talk a little bit more about that? She's saying we just don't have the capacity to support the amount of interest we get in conducting regular walk and talk clubs or local organizing. So she recognizes that there needs to be a focus on leadership development. Could you speak a little bit more towards that work that Cultiva has done and maybe dive in a little deeper in that Powerful People curriculum you mentioned?
Yeah, thank you. So under the curriculum that I mentioned, Powerful People, we were able to leverage funding from another source and establish these trainings here locally where residents could take part in and participate in. The trainings usually last about 6 months to a year, and they cover different topics such as, just sort of an introduction of policy system, environmental change, and looking at that aspect through the lens of, community health, individual health. It builds on each of those sessions. So, one of them is really around advocacy or, community empowerment, and then others on local government, understanding your local city jurisdiction and where the money comes from, where it goes, and all of these different important aspects, that really, again, speak to the foundation of leaders being able to know, but then from there being able to know who to go to and how to build a case around, let's say, the lack of bike lanes in their community or lack of infrastructure supporting walking. And so all of those sessions have, again, built on one another. They've been critical to these conversations, these changes in policy that we've seen. And just to be really transparent, we have not had the funding to utilize that leadership program the way that we would love to. We would love to be able to offer that more and in all of the different projects that we have here at Cultiva. But we have seen, again, with that connection and the residents who have gone through that program, just really stronger leadership and them being more vocal and more connected to the folks that really drive the policies as well. So.
Thanks, Brandie. And just a reminder to everyone joining us, feel free to type any questions you have in the chat box. Another question that's come up, Brandie, and I think you touched on this in your presentation, but I really want to highlight it because I know it's there are challenges that we see across the board in the local level as well as at the state level. But could you talk a little bit about the ways that you were able to work, bring residents to the table and really work with not just those elected officials in the walk-in talks, but city staff? And talk a little bit about what that was like, bringing residents into that whole city process.
Mm-hmm. Yeah, and I think that was just sort of one piece of the puzzle because, again, the walk-in talks or just the meetings with elected officials, really that ultimately had to take place at a very beginning and a later stage. But the city officials have been really key because that's where, especially with the active transportation plan, they've been very key in terms of the development and the sort of rollout, I should say, of that plan. And so we do have some of the city officials, again, that sit on the Bicycle Pedestrian Advisory Committee meetings. And so having that space with them, there has been in the past opportunities where residents have come in, they are public meetings, to attend and vocalize some of those concerns. But in our efforts of organizing and really trying to identify the priorities as the ATP was in the planning process, these were opportunities where city staff or partners were invited to those community meetings as well. And so the dialogue, there was a lot of sort of pre-planning or education with residents up front to really just understand what is the ATP and what are the opportunities here, potential opportunities, what would you like to see? And so all of that was taking place. And then there were, again, meetings where sort of the two, meaning the city officials or city staff and residents were able to come together, hear each other, identify priorities, and work more collectively.
Great, and you touched on, and some of these, Brandie, and for everyone on the call, I might be asking you to repeat a little of what was in the presentation, but it's because I know the awesome work you've done and I know how important it is, so I really want to highlight it. You touched a little on the active transportation prioritization tool. Can you and your team talk a little bit more about what that process was like in working with the city and making sure that some of those, really important items like equity were included in that tool and sort of what that process was like? I know that there are a lot of communities throughout the state that are constantly working on their active transportation plans, and I think it would be really important for them to know sort of things to consider and thinking outside the box, like with this rubric that you all worked on.
Yeah, thank you. So one of the partners that I did not mention up front, but definitely want to make sure that I lift up is that, we also worked with Change Lab Solutions. They were key in helping to identify a sample or example equity tool. And a lot of this, again, came from conversations about just, residents really feeling like their communities had been left behind for so long. And, how can we change that, especially given this big opportunity with the active transportation plan? And so Change Labs was key, again, in providing that example. It really did take multiple groups, Leadership Council, Cultiva, other groups really advocating for the development or I should say adaptation of this tool here locally. But it was a process. And so it was really a sort of this continuous process of trying to lift up the importance of, why there should be an equity tool. Thank you, Esther, for putting that up. Included, and you'll see, I don't know if you guys can read it, but you'll see sort of some of the different categories that it includes. And so the access and equity is one of them, and there's sort of these subcategories below that, and you'll see just, sort of those rankings or the scores given that particular project. And it is somewhat comprehensive, but again, links back to the importance of really having something in place that ensures that, you know, the plan in its full form, you know, when it's implemented is equitable. And I think, you know, again, it goes back to when this funding is also available, that these will be shovel-ready projects. And they've already gone through the process of being, you know, scored. They've ranked in such a way, you know, at a high ranking to where, again, they're shovel-ready.
Thanks, Brandie. And hopefully everyone saw that now your screen is showing this prioritization tool. Thank you, Tracy, for doing that. And this tool really is, you know, Brandie was speaking a lot to it, but I think it's something that's really key and would be great to see in some other areas. But, you know, they really got at the safety component. You know, they're still addressing bicycle and pedestrian collisions, but they built in the equity piece. And I think, you know, in terms of the work Cultiva has done, a lot of this was because, you know, some of these neighborhoods like Southeast Fresno had been left behind by some policies in the city or just hadn't seen that same investment. And so this was one way that Cultiva identified to be able to drive more resources to these communities by prioritizing projects and the way that the city would actually work to implement their active transportation plan. So are there any things now, I mean, this was really great and a good success, and it's so awesome to see this included with the city's plan. What has it been like now working to implement it? Can you speak a little to that, Brandie?
Mm-hmm. I will just say, you know, currently the city is looking to put out a proposal, and hopefully it will get funded. So they are looking for trying to identify those projects, leading projects right now as part of the proposal, and they are in the process of going through this scoring system through the equity tool to just, you know, make sure that those projects again are projects that ranked high, that, you know, goes back to what the community has expressed as part of the plan as well.
Awesome, and we have another question here. So Jill from SafeTREC wants to know what goals or objectives would you have if you did not need to worry about money or funding?
Well, you know, I immediately go back to, again, what's central to our work and sort of fundamental, and that has been our work with residents and strengthening that relationship there, but I think really, you know, helping to foster the leadership development. And so if I spoke to also earlier about us needing, you know, more funding to do that better or just more broadly, but I do think, you know, having more of that as the foundation to a lot of our efforts, not only just walking and biking, but, you know, beyond, I think is going to really, really, really be powerful, and speaks back to the title of the curriculum, but really build a base of just, you know, more residents who know, again, who to go to at the local sort of elected official level, and you know, get those priorities addressed, and who are really just savvy with a lot of the areas within, you know, that curriculum teaches, like media advocacy, like building your case, who's in your local government.
Great, thanks, Brandie. I don't see any more questions in the chat box, but I'm just gonna give a few seconds in case anyone wants to add anything else before we end the call and wrap up. But I know that Brandie and her team are extremely busy, so this is a great time to get any of those questions asked. We have another question here, and this is from Asha in Bakersfield. So our work on adding more elements to strengthen the current ATP was limited by funding. The Fresno ATP had much more funding allocated to the plan than the Kern. Was your input and recommendations to the ATP accepted fully, or was there pushback?
Yeah, it wasn't accepted fully, and I think that is typical of any plan. There definitely was pushback. That we did see some wins. The equity tool was one of the biggest ones, but I think it's one of those you gain some, you lose some sort of scenarios.
Yes, definitely, and I know from some my history with Cultiva, that our partners at Leadership Council came in with a very strong ask. And I think that helped also get more of those wins in, because basically came in like everything with the cherry on top, and plus that is what was asked for in this strong letter. And then we worked down to get closer. I'd say we got most of the things that were being asked for in the ATP, and with that resident engagement. But I think that was also key as well, right, Brandie, is having those partners who could come in with that stronger ask, that maybe have more flexibility in funding and in what they're able to do in advocacy-wise.
Yeah, and maybe just another add-on is, we continued to grapple with the idea around how to address loose dogs. And so that was still one of those areas that was not, and still is, is not addressed in the plan. It is a real big challenge in terms of what government body that is responsible for that, and the funding is very limited, staffing is very limited to address that. And so we are really searching still for some of those funding opportunities, as well as just other case studies of maybe what other communities might have done to address issues around loose dogs, because that does have a direct connection back to residents, again, not feeling safe and not able to walk.
Great, thanks, Brandie. And I do want to point out in the chat box, Lisa Peterson has shared, Change Lab Solutions has a Building Healthy, Equitable Community series for exploring the topic of health equity. So for those of you on the call or listening to this as a recording, you might want to check it out. And the link is changelabsolutions.org/the-series. So that's in the chat box. So be sure to check that out when you have some time. I don't see any other questions in the chat box, and I think I'm all tapped out for questions for Brandie and her team. So at this point, if there's no more, we'll go ahead and wrap up. I do want to share with everyone on the call that we will be sending out these slides via email. For those of you who registered, we'll also be sure to send out a PDF of the prioritization matrix that Brandie talked about and that you all saw on your screen. And we'll be sure that you get Brandie's contact information so that any follow-up questions can go directly to her as needed. And there will be a link available to this recording. So if you enjoyed today's session, if you want to share it out with other partners or other people on your team, there will be a recording available. So we're at the end of our session together. We're just a little bit early. I don't think anyone minds going to lunch a little sooner. So we'll go ahead and wrap up at this time. Brandie, I want to thank you so much for joining us and for preparing this webinar and talking to us a little bit more about the great efforts that Cultiva has done. Kudos to you and your team. So thank you so much for joining. And I hope everyone has a great day. And I think that's going to wrap it up.
Thank you so much, Esther. Thank you, everyone.
Thanks. Have a good one.
Thank you. Thank you, Brandie.
Thank you. Bye-bye.
Bye.